In the first video, I talked about what health is, and I also talked about the dimension of health. But in this video, I'm going to talk about the determinants of health. I will talk about the different perspectives on health. Health field concept, ecological perspective, and globalization and health. Health is defined as a state of a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health is viewed in so many ways. So there are different perspectives on health. So health is viewed as a human right, as a consumption good, and as an investment. Some view health as a right similar to justice or political freedom. The World Organization Constitution states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of their race, religion, and political belief, also economic or social condition. And others view health as an important individual objective or material aspect. The third view considers health as an investment, indicates health as an important fundamental for development. Now, what are the determinants of health? So determinants of health, these are factors that influences our health. So health or ill health is the result of a combination of different factors. There are different perspectives in expressing the determinants of health of an individual or a community. And one of them is the health field concept. So let's talk about the health field concept. According to the health field concept, there are four major determinants of health: human biology, environment, behavior or lifestyle, healthcare organization. Let's break them down. The first one is human biology. Every human being is made up of genes, and there are factors which are genetically transmitted from parents to offspring. And as a result, there is a chance of transferring defective traits. The good example I can give is sickle cell anemia and Down syndrome. And this simply means that the genes that are transferred from the parent to the offspring determines the offspring's health. The second one is environment. Both natural and built environment are closely linked to our health, and environment is all that which is external to the individual human host. Those are factors outside the human body. Environmental factors that could influence the health include life support, which is food, water, and etc. We have physical factors like climate change and rainfall. We also have biological factors, which is microorganisms and biological waste. Psychosocial and economic factors, which is income level and access to health care. Now let's talk about lifestyle or behavior. Lifestyle is an action that has a specific frequency, duration, and purpose, whether conscious or unconscious. So lifestyle is all about what we do and how we act. Recently, lifestyle by itself received an increased amount of attention as a major determinant of health. Lifestyle of an individual affects their health directly or indirectly. For example, smoking cigarettes and safe sexual practice, eating contaminated food, and other behaviors that may affect our health. The last one is healthcare organization. Healthcare organization, in terms of their resources in human power, equipment, and money, they determine the health of the people. It is concerned with 1. Availability of health services. People living in areas where there is no access to health services are affected by health problems and have lower health status than those with accessible health services. Accessibility, which is in terms of physical distance and finance. Acceptability of the service by the community. The scarcity of health services and quality of care that mainly focuses on the comprehensiveness, continuity, and integration of health care. Now, let's talk about the ecological perspective. The other view of the determinants of health is from the ecological perspective. Ecological perspective outlines 4 different factors affecting health, which is physical determinants, social, cultural determinants, community organization, and behavioral determinants. What are physical determinants? So these are physical factors affecting the health of a community. For example, the geography, which is the high land versus low land. The environment, man-made or natural catastrophes, and last one, the industrial development, which is pollution, occupational hazards. The second factor is social-cultural determinants. The social-cultural factors affecting the health of a community include beliefs, traditions, and social customs in the community. Community organization. Community organization include community size, arrangement, and distribution of resources. The last one, we have behavioral determinants. The behavioral determinants affecting the health include individual behavior and lifestyle, which affect the health of an individual and the community. For example, smoking and alcoholism. Let's now talk about globalization and health. Globalization is a process of increasing political and social interdependence and global integration that takes place as a capital, goods, concepts, ideas, and values diffuse across the stated boundaries. Globalization must ensure that people, particularly the poor, enjoy better health. That is the most important factor in improving the economic well-being of the population in general. Globalization can have a positive or negative or mixed effect on health, and these effects includes: 1. Externalities of some diseases due to increased communication and increased human mobility. The second one is tobacco-induced diseases. Also, food market and obesity, as well as chemicals in food, weakening your labor market due to the greater power of mobile capital. It also has a diverse effects on the environment, increasing effects of international and bilateral agents, and not to forget the rapid spread of infectious diseases. To see more videos, don't forget to subscribe, to like and share.